Today we are going to talk about vital signs. Vital signs are a crucial element of patient assessment, requiring diligent evaluation and interpretation by healthcare professionals to ensure informed decision-making and high-quality care. Let's look at normal values first. Temperature, 97.8, 99.1 degree F. Pulse, 6,100 beats per minute. Respirations, 12 to 20 breaths per minute. Blood pressure, 120/80 mm of mercury. Oxygen saturation, 95-100%. When assessing the pulse, it's essential to note the strength using a pulse scale. The pulse scale typically ranges from 0 to 4+, with 0 indicating absent or no pulse, 1+ indicating a diminished pulse, 2+ indicating a normal pulse, 3+ indicating a full pulse, and 4+ indicating a bounding pulse and strong pulse. Pulse strength interpretation. If no pulse felt, it indicating possible arterial blockage or severe hypertension. Weak and thready pulse, often seen in cases of shock or peripheral artery disease. Normal pulse, indicating good blood flow and cardiac function. Stronger than normal pulse means there is possibly indicative of anxiety, mild hypothyroidism, or early stages of sepsis. And bounding pulse, often associated with conditions like fever, anemia, or hyperthyroidism. Hypothermia and hyperthermia are the situations related to overwhelmed body temperatures. The following context will highlight the key differences between hypothermia and hyperthermia. Look on the basic comparison, hypothermia and hyperthermia. A term hypothermia means body temperature below 95 degrees, and hyperthermia means body temperature above 99.5 degrees K. Hypothermia caused by overexertion or prolonged exposure to cold temperature. Remaining in cold waters for a longer period of time. Wearing wet clothes in the cold outdoors. And hypothermia due to extended exposure to dry and hot conditions. Wearing tight or heavy clothing in a hot climate. Having some disease that hampers your sweating abilities and excessive dehydration or water loss. Respiration rate refers to the number of breaths taken per minute while at rest. Here are few common terms to describe abnormal rates, which are bradypnea, fewer than 12 breaths per minute, tachypnea, more than 20 breaths per minute, apnea, temporary cessation of breathing, and dyspnea, difficulty or labored breathing. Blood pressure is the measurement of the pressure or force of blood inside your arteries. Systolic blood pressure, pressure exerted when blood is ejected into arteries. Normal systolic blood pressure is 120 mm of mercury. Diastolic blood pressure, pressure blood exerts within arteries between heartbeats. Normal diastolic blood pressure is 80 mm of mercury blood pressure versus heart rate. Both of these have to do with your heart, but they're two different things. Blood pressure is how powerfully your blood travels through your blood vessels. Heart rate is the number of times your heart beats in 1 minute. Blood pressure categories. Normal blood pressure, systolic less than 120 and diastolic less than 80, elevated blood pressure, systolic 120, 129 and less than diastolic 80, hypertension stage. 1. Systolic 130, 139 or diastolic 80, 89, hypertension stage. 2. Systolic 140 or higher or diastolic 90 or higher, hypertensive crisis. Systolic higher than 180 and or diastolic higher than 120. Here are questions for review. Thank you for watching. If you found this video helpful, please like, subscribe and follow us for more educational content. Stay informed, stay healthy.